Hey everyone, how's it going? Hope everyone is doing well. I wanted to do another update with my new medication that I've started for my anxiety. Um, I'm, I tried Zoloft 25 milligram for 2 weeks. The first week it wasn't that hard to adjust to, but I did have some side effects with it. I did experience nausea. Also, we always make our healthy dinners. Um, I would get full really fast, or it would take me a while to eat, and I just kept chewing and chewing, and it's like I wasn't hungry to eat, basically. And then if I would have a little snack or something, and later in the day, I would get really nauseous and feel like I want to throw up. So I haven't. That's gotten better. Um, I think now I got adjusted to the 25 milligram. I do notice I'm a lot more calm, but during certain situations, I did have my anxiety creep back in. Um, it wasn't as bad, but I could feel it, so I kind of had to calm myself down. So I was on it for 2 weeks. Yesterday was my last dose, and today I started the 50 milligram, which my doctor stated that that's usually the normal milligram that she prescribes and what actually makes it help you even more. So I started that today. I haven't noticed anything different, so I'll keep an eye out to see if I get any more side effects from the medication. And I also wanted to share that my doctor had brought up going to behavioral health to see, to go through therapy. I did get a referral, and I had my first appointment today. It was actually telehealth, so I kind of explained everything to the therapist, and what has affected me, and basically give her a background what I'm going through. And she's trying to help me come up with strategies and to make me calm down and to actually accept what I'm going through. That's my new norm. I told her I've accepted it already, but the way I was explaining it to her, she knew right away. She goes, "You have accepted it, but you haven't." So she showed me this chart where it shows pain, grief, all these things. And the chart, she goes, the one that has acceptance on it, but it was like a lot of circles. It was like if you scribbled a bunch of circles and stuff. If you were doodling, she goes, "You're bouncing off each one." And she says, "I have a lot of grief," and she goes, I understand you're trying to accept it, but you really have to accept it. So she's, "I know you haven't yet," which, I always tell everyone I've accepted it, but that's just, I think, me just saying it, because deep down inside, I don't think I've accepted it. And I think that was another reason that was contributing to my panic attacks, because, I told her every time I see my neurosurgeon, there's always a new issue. And, I guess I don't grieve properly when it comes to those type of appointments. Just like he told me to do a fusion was too risky, even though he told me that last year. But when he told me this time, I guess it never fully sinks in, and I just don't address my emotions. So hopefully this will help me some. And I see her again in June. So from now to June, she says if you get lost in your thoughts and you start thinking negative about your situation and you feel the anxiety starting to creep in, you need to stop it, because she said anxiety is a feeling, and the only way you can control it, it's up to the person how they handle it and control it. So she said it's not easy to do. She's experienced that when she was younger as well. So she has a lot of knowledge about anxiety, and which is why she started doing therapy. She didn't shut me down. Like, I remember I had a therapist from there a couple years ago, and she would shut me down if I talked about my diagnosis or anything back then when I was really sick. And I was like, well, today wasn't a good day because, this was happening. She's like, "Oh, you can't be negative. You can't be negative. You need to be positive." But, little did she know, she didn't know what I was going through either. And I tried to explain it, but I don't know if she thought it wasn't as bad as it is. But this one so far seems okay. And that's why I stopped a few years ago, because I just didn't like the vibe I was getting. And it was kind of shutting me down when I was on the phone with her, because I really didn't know what else what to talk about due to how she would respond to me. So I'm going to work on that and, see if that helps. When you're dealing with multiple chronic illnesses, and even how you got diagnosed. Like, I was fine working, then, you go home, clock out at 5 o'clock, you're almost home, and boom, something happens and your whole life just changed. And then the ripple effect, how it just keeps, stuff kept adding and adding, then getting gaslighted, and the mistakes from the surgery, and just over the past few years, it's just been a lot of ups and downs. And I'm trying my hardest to get better, and try to keep pushing forward. And that's why I started, why I advocate and make the content that I make, to try to help me, and help others, but I really gotta get myself internally better too. I can't keep brushing it off. And I think that's what a lot of people do too. They just brush it off, and you kind of have that attitude like, oh, it's all good, I'll get through it. But you can't look at it that way, because it could just keep getting worse and worse. And I don't want to be in a really low spot while dealing with everything else. It will just be overwhelming. And no one else, we can't really stress out like that and get, make us really sick. So that went really well. I'm glad I didn't have any bad side effects with the medications. Other than that, I'm still waiting to hear back about my nerve ablation, which I actually have to call my surgeon's office tomorrow and figure out what's going on, because it's going on the 3rd week now and I haven't heard anything. But another thing, my current pain management doctor said to have an ablation in the C2, C3 is high. Usually they don't do them that high. So I got to find out. I don't know if he was just saying that because I'm not getting it done with them, or I haven't really done too much research about it. So if anyone knows about that level, getting a nerve ablation, is it safe or not? But hopefully that works. With my symptoms, I thought I was starting to flare up a couple days ago. I guess I wasn't, but for the last week and a half, I've been having hints at a flare up. I'll get the real strong Chiari headache, the strong neck pain. It will last for a day. Then like today I have it, but it's not as severe. So like my symptoms have been going up and down a lot lately. So I guess it's just, I just gotta, work on that and fully accept that that's how my new normal is gonna be. And I also have a tendency to get lost in my thoughts. I'll watch TV and just doze off, and then my mind will just start. I'm just thinking about so many things at once, and I could feel the anxiety creeping in. I'll get really flush. I'll get really clammy. My heart will start racing, and I'll just start getting scared. Then the last one I had, I got better at calming it down. I have to work on not getting lost in my thoughts, and also going to places with a lot of people. I tend to get really anxious when I'm it's like at BJ's, it's like a Sam's Club. When we go there, I get really overwhelmed and flustered. And I never used to be like that. I always used to go out and shop and, do whatever without any issues. But now if I too close to too many people, I get really nervous for some reason. I get anxious. So I tried to, when we do go to stores, we've been going like when they first opened to avoid it. But I'm going to work on that so I don't have to live that way either. I don't want to live always anxious. I want to be able to enjoy life the best way I could, even with these limitations. But I still want to live. Life passes you by really quick. I'm going on, 6 years since being diagnosed. Look how fast how fast time went. And I'm like, man, it seems like a blur with all the doctor's appointments, procedures, the imaging, the tests. Like life just, the past 6 years just flew by, and I don't remember time going this fast. I don't know, maybe it's because we just have so much going on with our health. So I just want to do a quick video, give you a little update. I'll make one in a couple weeks. I know I wanted to do one every week, but making my other content and everything else, it's kind of hard. But I hope if you guys have any suggestions, and if you guys want to share your experience, feel free to leave it in the comment section. I always love hearing from you guys and responding to each of your comments. All right, and you guys take it easy, and we got this, and take it one day at a time. You guys, take care.